Hello, this is Kyuha Chong. My major field of interest is how to cure the malignant brain tumors, especially glioblastoma multiforme, which is known as incurable disease. Recently, I and my advisor, Professor Choi, have focused about the application of nanoscale drug delivery system for the diagnosis and treatment of malignant brain tumors. The topic I will going to discuss and talk about today is about the result that occurred lately, enhancement of the photocytotoxic efficiency of sub-12 nanometer size therapeutic polymeric micelles and malignant brain tumor cells. From now on, I will use malignant brain tumor as abbreviation MBT. Prior to the beginning, I just want to instruct you about the current problems and causes that limit the treatment efficacy of MBTs. Brief in summary, current treatment modalities for MBTs are surgical resection, chemotherapy, and radiation therapy. Even though surgical resection is known as most effective treatment modality, it is nearly impossible to resect tumor totally. Hence, a great deal of clinical trials are ongoing, and theranosis with photosensitizer is suggested as an alternative. But to enhance the efficiencies, drug delivery to MBT is main problem to overcome. Either with chemotherapy or radiation therapy, the drug delivery to MBT is a problem of the greatest importance also. The main factor that limits drug delivery to MBT is presence of a barrier which is called blood-brain tumor barrier, the BBTB. Function as a double-edged sword, the organ-specific structure for the protection of brain from the toxins and inflammatory cells block the drug delivery to MBT. From the 1960s and 70s, there were lots of studies to investigate the BBTB. Comparison between MBT and other cancers and between the environmental differences, non-cranial versus cranial, revealed that under the 100 nanometer size might be the relative size for the penetration that overcrossed the BBTB. And recent studies identified that because of the higher interstitial fluid pressure, the physiologic size is much smaller, so below 12 nanometer size of nanoparticle are only effectively penetrate the BBTB. To the best of our knowledge, there were no other reports that evaluate sub-12 nanometer size polymeric micelles as phototherapeutics for MBTs. So, to validate the hypothesis of sub-12 nanometer size polymeric micelles as an effective phototherapeutics for the MBTs, the study was designed with the aims of successful engineering of polymeric micelles and evaluation of its phototherapeutic efficiencies with in vitro experiments. To evaluate their phototherapeutic effect, a photosensitizer hypericin was chosen because it is a hydrophobic compound which is expected to be feasibly incorporated into the micelles, and also because of that has fluorescence with photocytotoxic effects simultaneously. And to optimize the size, 3 different kinds of micelles were prepared by varying the length of DSP MPEG. The synthesis of the micelle was performed with the major 3 steps. After drying the lipid components under vacuum, the lipid film was hydrated with water or PBS under continuous sonication, and micelles of the desired size were obtained by filtration. To verify the size of the engineered micelle, dynamic light scattering and transmission electron microscopy imaging were performed. With the analysis of the result, the size of the engineered micelles were below the 12 nanometer in size, which is satisfied with the aims of this study. As a proof of concept experiment, 2 other groups were prepared, the parental aggregated form and pegylated form, which are previously used form within the vitro, in vivo experiments and clinical trials. These 3 formulations of drug was applied to U251mg human MBT cells for the evaluation of phototherapeutic efficiencies. Compared with other anti-cancer chemotherapeutic agents, photosensitizer exhibits negligible cytotoxicity in the absence of irradiation of light. Therefore, by using photosensitizer as a drug, non-specific uptake of the nanoparticle will not pose a high risk to the cells because the toxicity is negligible under normal circumstances. To ensure this, dark cytotoxicity, the toxicity of the agent without a light irradiation was evaluated. Firstly, and within the phototherapeutic doses below 10 micromole of hypericin, the dark cytotoxicity was negligible, and either with various formulations of the drug, including engineered polymeric micelles, cytotoxicity was negligible also, as expected. Subsequently, evaluation of the phototherapeutic effect between drug delivery systems was performed. For the investigation, LED-based light irradiation system was established. With the analysis of dosimetry, under the light irradiation system, photocytotoxic efficiency was evaluated with the following of 2 hours incubation of 5 micromole of hypericin and irradiation of light at a doses of 0.1 joule per centimeter square. Interestingly, the engineered polymeric micelle were exhibited more than 2.5 times higher photocytotoxic efficiency compared with 2 other formulations. Because main mechanism that brings photocytotoxicity to the cells with photodynamic therapy is related with the actions of photosensitizer in mitochondria or in lysosome, and hypericin is locally distributed mainly in the mitochondria, ER, and lysosome. Evaluation of co-localization of hypericin in the mitochondria, ER, and lysosome for all formulations were performed. Further evaluation, fluorescence-based analysis was taken. The fluorescence images and co-localization coefficients indicated that all of the hypericin formulations were similarly co-localized in the lysosomal compartment. Notably, the co-localization value of hypericin in the mitochondria and in the ER was not statistically different for parent-aggregated form and pegylated form. However, the calculated values for the engineered micelle in the mitochondria and the ER was significantly higher and lower, respectively, than those for 2 other formulations. By encapsulating a photosensitizer with our polymeric micelle, the photocytotoxic efficiency induced by the delivered hypericin was significantly higher in U251mg human MBT cells. This finding was explained in part by the increased co-localization of hypericin in the mitochondria. We hypothesized that a difference might exist in the intracellular organ-specific drug delivery between micelle and the other formulations. Specifically, we assumed that co-localization or uptake of hypericin in the mitochondria might be enhanced with the engineered micelle. The differential uptake in the mitochondria might be due to increased permeability of the mitochondrial membrane by local action of disassembled polymeric chains from the internalized micelles. But still, this is a hypothesis, so to make certain of it, I think further experiment and evaluation should be followed by. To date, various nanoparticles have been reported and are anticipated to overcome some limitations of conventional drug delivery to MBTs. Our engineered micelle is the first example of a sub-12 nanometer size micelle, which has been proven to be more efficient in photodynamic therapy than its parent drug form or pegylated form. Although this engineered micelle was neither designed for active targeting nor lipid modification for enhancing cellular uptake, the agent was highly accumulated in the mitochondria, consistent with phenotypic analysis of photocytotoxicity. So, we expect that the conjugation of cancer cells or mitochondria-specific targeting ligands on the surface of the micelle would significantly increase either the cellular uptake of the agent or the photocytotoxic efficacy. And we anticipate this engineered micelle may act as superb therapeutic agent for MBTs and spur the application of sub-12 nanometer micelles for MBT therapeutics. The contents are published online at Chemical Communications at September 11th of this year and will be published at December 21st as a front cover story. I hope you enjoyed the talk.